It's now time for GH joint.
Going to show you how to scan the posterior glenohumeral joint. Now we removed the head of the skeleton just for photographic clarity, but your patient's normally going to be side-lying towards you with this ultrasound machine just beyond. Now your landmark is going to be the spine of the scapula, and the orientation of the probe is going to be long on the spine. The movements are going to be dropping inferiorly off the spine and continuing inferiorly until you can see the rounded head of the humerus quite prominent in the near field of the ultrasound image, and the bony glenoid just medial to that on the other side of the screen, deeper down. Now the area of interest for an injection is going to be the sulcus between them. So that's how you scan for the posterior glenohumeral joint.
So now let's draw it. So this is the humerus, or the head of the humerus. This is the glenoid of the scapula, and the scapula continues on over here. Cartilage, well, this is the articular cartilage, the hyaline articular cartilage of the humeral head. This is the fibrocartilage, known as the labrum. Joint fluid, well, we can't really see any joint fluid because there's no effusion, but we know it's going to line the articular cartilage. The ligament, well, we know what connects bone to bone is ligament, so then it's going to be ligament on top. And then tendon, well, there's a strip of the infraspinatus tendon running through here that then will attach on way over here. And then muscle, well, the bulk of this picture is actually muscle. So that is infraspinatus muscle with some, that's going to be deltoid muscle on top. All right, let's clear it away and draw it one more time. Bone, bone, cartilage, cartilage. Fluid, well, you can't see it, but it's there. Ligament, that's going to connect all these together. Tendon, can't see much, but there's the tendon, the infraspinatus. And muscle, well, all this is muscle.
Going to show you how to scan and inject a glenohumeral joint from the posterior aspect. At Sport Medicine Ultrasound Canada, we like to do it this way. However, there are some different ways to approach it. Here's our preferred approach. Your patient is going to be side-lying facing towards you with the affected shoulder up. Your landmark is going to be the spine of the scapula, and we see that in the view here. Your movements are going to be inferiorly from the spine of the scapula until you see the glenoid and the humeral head in view. I just slid just a touch laterally from there. I can now even rock the probe a bit this way, opening a bit more space where I can get my needle in under the probe, and my area of interest is just here. My needle entry angle is going to be from here, quite steep downwards. And that's how we do a glenohumeral joint injection.
Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.